Are you preparing for the USMLE? Let's test your knowledge with some high-yield USMLE-style questions.
Question number 1. The primary pacemaker of the heart is located in the, your answer sir, Purkinje fibers, atrioventricular node, bundle of His, sinoatrial node. The correct answer is option D, sinoatrial node. The SA node, located in the right atrium near the superior vena cava, is the natural pacemaker of the heart. It generates electrical impulses at a rate of 60 to 100 beats per minute, which is faster than any other cardiac tissue, establishing it as the dominant pacemaker. Question number 2. A 45-year-old man presents with tremors at rest, bradykinesia, and cogwheel rigidity. The neurotransmitter primarily deficient in this condition is, your answer sir, dopamine, acetylcholine, serotonin, GABA. The correct answer is option A, dopamine. This patient has classic signs of Parkinson's disease, which results from degeneration of dopaminergic neurons in the substantia nigra pars compacta. The loss of dopamine in the nigrostriatal pathway leads to the characteristic motor symptoms. Question number 3. The hormone responsible for milk ejection during breastfeeding is, your answer sir, estrogen, prolactin, oxytocin, progesterone. The correct answer is option C, oxytocin. Oxytocin, released from the posterior pituitary, causes contraction of myoepithelial cells around the alveoli, leading to milk ejection, let-down reflex. Prolactin is responsible for milk production, not ejection. Question number 4. A 60-year-old diabetic patient develops a foot ulcer that fails to heal. The cranial nerve responsible for sensation in this area is, your answer sir, femoral nerve, tibial nerve, branch of sciatic, L4 to S3, obturator nerve, common peroneal nerve. The correct answer is option B, tibial nerve. The tibial nerve provides sensory innervation to the sole of the foot. Diabetic neuropathy commonly affects this nerve, leading to loss of protective sensation and increased risk of foot ulcers that go unnoticed. Question number 5. The most common cause of acute pancreatitis in developed countries is, your answer sir, medications, alcohol abuse, hypertriglyceridemia, gallstone. The correct answer is option D, gallstones. Gallstones account for approximately 40 to 50% of acute pancreatitis cases in developed countries, followed closely by alcohol abuse, 30 to 35%. The gallstone obstructs the ampulla of Vater, causing pancreatic duct obstruction and autodigestion. Question 6. A newborn presents with cyanosis that worsens with crying. The ductus arteriosus is patent. The most likely diagnosis is, your answer sir, tetralogy of Fallot, ventricular septal defect, atrial septal defect, patent ductus arteriosus alone. The correct answer is option A, tetralogy of Fallot. Tetralogy of Fallot is a cyanotic congenital heart disease that becomes more apparent when the infant cries, increased oxygen demand. The patent ductus arteriosus may initially provide some pulmonary blood flow, but cyanosis worsens as it closes or when oxygen demand increases. Question number 7. The cells responsible for bone resorption are, your answer sir, osteocytes, osteoblasts, osteoclast, chondrocytes. The correct answer is option C, osteoclasts. Osteoclasts are large multinucleated cells derived from hematotic stem cells, monocyte macrophage, lineage. They secrete acid and enzymes that break down bone matrix, playing a crucial role in bone remodeling and calcium homeostasis. Question number 8. A 25-year-old woman presents with heat intolerance, weight loss and tremors. Her thyroid is diffusely enlarged. The antibody most likely responsible is, your answer sir, TSH receptor antibody, TSI, antithyroid peroxidase, anti-TPO, antithyroglobulin, anti-TSH. The correct answer is option A, TSH receptor antibody, TSI. This patient has Graves' disease, the most common cause of hyperthyroidism. TSH receptor stimulating antibodies TSI bind to and activate the TSH receptor, causing unregulated thyroid hormone production and gland enlargement. Question number 9. The vitamin deficiency that causes megaloblastic anemia and is commonly seen in vegans is? Your answer, sir: vitamin B1, vitamin B6 pyridoxine, folate, vitamin B12 cobalamin. The correct answer is option D, vitamin B12. Vitamin B12 is found almost exclusively in animal products, making vegans at high risk for deficiency. Vitamin B12 deficiency impairs DNA synthesis, leading to megaloblastic anemia, and can also cause neurological symptoms like subacute combined degeneration of the spinal cord. Question number 10. The drug of choice for acute anaphylaxis is? Your answer, sir: corticosteroids, diphenhydramine, epinephrine, albuterol. The correct answer is option C, epinephrine. Intramuscular epinephrine 1:1000 in the anterolateral thigh is the first-line treatment for anaphylaxis. It acts on alpha and beta receptors to reverse airway obstruction, hypotension, and other life-threatening manifestations. Antihistamines and steroids are adjunctive but not sufficient alone. Question number 11. A 70-year-old man has sudden onset of severe tearing chest pain radiating to the back. The most likely diagnosis is? Your answer, sir: pericarditis, myocardial infarction, pulmonary embolism, aortic dissection. The correct answer is option D, aortic dissection. The classic presentation of aortic dissection includes sudden severe tearing or ripping chest pain radiating to the back. Risk factors include hypertension, connective tissue disorders, and advanced age. This is a surgical emergency requiring immediate diagnosis and management. Question number 12. The most common pathogen causing community-acquired pulmonary pneumonia is? Your answer, sir: Streptococcus pneumoniae, Haemophilus influenzae, Staphylococcus aureus, Mycoplasma pneumoniae. The correct answer is option A, Streptococcus pneumoniae.
Question number 13. The antibody class that crosses the placenta to provide passive immunity to the fetus is? Your answer, sir: IgM, IgG, IgA, IgE. The correct answer is option B, IgG. IgG is the only antibody class that can cross the placenta via FcRn receptors. This provides passive immunity to the newborn for the first several months of life. IgM is too large, and IgA is found primarily in secretions. Question number 14. A 55-year-old alcoholic presents with confusion, ataxia, and ophthalmoplegia. The deficient vitamin is? Your answer, sir: niacin, vitamin B12, folate, vitamin B1. The correct answer is option D, vitamin B1. This patient presents with Wernicke encephalopathy caused by thiamine deficiency, common in chronic alcoholics due to poor nutrition and impaired absorption. The classic triad includes confusion, ataxia, and ophthalmoplegia. IV thiamine must be given before glucose to prevent precipitation of Korsakoff syndrome. Question number 15. The mechanism of action of warfarin is? Inhibition of vitamin K epoxide reductase, factor XA, thrombin factor 2A, platelet aggregation. The correct answer is option A, vitamin K epoxide reductase. Warfarin inhibits vitamin K epoxide reductase, preventing the recycling of vitamin K. This leads to decreased synthesis of vitamin K-dependent clotting factors 2, 4, 9, 10, and protein C and S. Factor 7 has the shortest half-life, so PT and INR rise first. Question number 16. A 30-year-old woman presents with butterfly rash on her face, joint pain, and proteinuria. The most specific antibody for her condition is? Your answer, sir: antihistone antibody, anti-nuclear antibody, anti-Smith antibody, anti-double-stranded DNA. The correct answer is option C, anti-double-stranded DNA. This patient has systemic lupus erythematosus, SLE. While ANA is highly sensitive, greater than 95%, anti-dsDNA is highly specific for SLE and correlates with disease activity and lupus nephritis. Anti-Smith is also specific but less sensitive. Question number 17. The first-line treatment for absence seizures in children is, your answer, sir. Phenytoin, ethosuximide, carbamazepine, valproic acid. The correct answer is option B, ethosuximide. Ethosuximide is the first-line treatment specifically for absence seizures, petit mal, which present as brief episodes of staring and loss of awareness in children. It blocks T-type calcium channels in thalamic neurons. Valproic acid is also effective but has more side effects. Question number 18. The muscle responsible for abduction of the vocal cords is, your answer, sir. Posterior cricoarytenoid, lateral cricoarytenoid, thyroarytenoid, cricothyroid. The correct answer is option A, posterior cricoarytenoid. The posterior cricoarytenoid is the only muscle that abducts the vocal cords, opening the glottis. All other intrinsic laryngeal muscles adduct the cords, or modify tension. Bilateral injury to the recurrent laryngeal nerve can cause life-threatening airway obstruction because the cords cannot abduct. Question number 19. A 2-year-old child presents with a barking cough and inspiratory stridor. The most likely diagnosis is, your answer, sir. Foreign body aspiration, epiglottitis, bacterial tracheitis, croup, laryngotracheobronchitis. The correct answer is option D, croup. Croup is typically caused by parainfluenza virus and presents with the classic triad of barking, seal-like cough, inspiratory stridor, and hoarseness. It's most common in children 6 months to 3 years. The steeple sign on X-ray, subglottic narrowing, is characteristic. Treatment includes corticosteroids and nebulized epinephrine for severe cases. Question number 20. The type of hypersensitivity reaction involved in the Arthus reaction is, your answer, sir. Type 2, antibody-mediated. Type 1, IgE-mediated. Type 3, immune complex-mediated. Type 4, cell-mediated. The correct answer is option C, type 3. The Arthus reaction is a local type 3 hypersensitivity reaction caused by immune complex deposition in vessel walls. It occurs when antigen is injected into tissue where there are pre-existing antibodies, IgG, leading to complement activation, neutrophil recruitment, and localized vasculitis with edema and necrosis within 3 to 8 hours.